Grief and bereavement reaction. Grief is the personal and emotional state of bereavement. So it can be measured in tool by the CBI, core bereavement items, and other scales are also there. So intrinsic grief thought scale and cognitive questionnaires and for children, etc. But in general, the child is saddened, depressed when someone has died, or there are some bad sort of things happen in the family and around. So mostly death. The child experience below 3 years, the child may not understand the word death or what really it means. But afterwards, there's little bit understanding. So there can be, there's no standard reaction. It differs widely from person to person. The so-called the higher the upper level and IQ people, they express in different way. They keep quiet and calm, and they do not allow the tear to be seen by other people. So they do not have any body language or gesture and posture which make them different from the other days. But they have inner anxiety, inner sort of bereavement or grief, whatever you call it. So there is no correct way. The different people react in different way, and then usually a little bit the disadvantages socioeconomic group, they express what they feel like. This is simple and then straightforward. So in dealing the grief, the physician's the responsibility is to explain the child who understands the things in full and truthful way, and staying physically mental at times, maybe attending a funeral if possible, and the sharing the bereavement with the child is useful. And the rule over here is an educator, is an critical decision making. Breaking the silence of bad news in appropriate way is also important. And declaring, suppose ICU death declaration and other bad diagnosis declaration, and termination of life determination. These are the critical time that the physician face. So the complicated reactions it will be dealt with in that way. Maybe a psychiatrist or psychotherapist at times involved in this process of grief or bereavement reaction.